Well, good afternoon, everybody. It's our daily briefing. I'm here with Paul and Josh, and here via Zoom, we've also got Andy Mays, who runs insurance, and Kurt Westby, if anybody has questions regarding our catch-up on the unemployment claims. Let me just quickly run over some of the numbers for you, if you have that, Max. You'll see in terms of positive cases, the trend is sort of continuous. You see the tests themselves go up and down depending on a variety of variables. It's just incredible to me that there's a national shortage of swabs. Swabs are like Q-tips. How can this country not have enough swabs so we can accelerate the testing, which is so key to getting people back to work? But anyway, those are interesting numbers. I think you're probably noticing laboratory confirmed deaths. That's a big number, 197. What the hell is going on? In terms of the deaths that are reported out of the hospitals that we know, that number is consistent with what we're used to. We did have a catch-up here with about 170 folks, our citizens, who sadly passed away. Often there's a catch-up because we don't know. They die at home. They don't die at a hospital. We don't know what exactly is related to the death, so those are catch-up numbers. But I think you should just take a look there and know that that death number does take us up to 868. The currently hospitalized, 129. We saw a downward trend that's leaking up a little bit. Let's go to the next slide. We can talk about that a bit. This is a trend that's sort of similar to what you've seen before. Fairfield, you see, was flattening out, Fairfield County, just a week ago, and today you see it ramping up a little bit, and I described recently that was a bit due to the flare-up in Bridgeport. Next, you see that New Haven was flattening out, ramping up a little bit as well, and finally, Hartford County. Next slide, please. This slide is really important because I always give you the net numbers. I always show you, this is the net increase in the number of people who are in ICU beds. And that's really important because that tells you about our capacity in our different hospitals. But it doesn't necessarily tell you the trend on infections, and that's registered by hospital admissions. The net numbers, admissions versus discharges, we have a lot of people being discharged. But in case anybody's getting complacent, you'll see the number of admissions in Fairfield County is going up as fast as it ever has. You'll see perhaps that while New Haven is leveling off a little bit in terms of that slant, Hartford is going up. So these are numbers that we track all the time, we think is a leading indicator in terms of what's going on. But basically, I think you see the numbers are still choppy. So there's been a little bit of hope out there that we weren't going up geometrically or exponentially like we used to say. There's still a lot of admissions in hospitals. That means that reflects infection rate, and that reflects the fact we still have some work to do. What's the next slide there? And that's it by counties. Let me just say a couple of things. One, this is April 15th. This used to be known as Tax Day, not this year. This year our tax day is July 15th because we've been able to push that off, as the federal government has also pushed that off to give everybody a little bit more breathing room in terms of managing their cash flow. And Tax Day always used to lead to tax protests. Well, today is not tax day, but there are still a number of stay-at-home protests around the country. And I was just on the phone with all my fellow governors, just giving a heads up on what's going on. Out of Michigan, I was sort of interested to hear that in Lansing, Michigan, there's Operation Gridlock, and cars are honking their horns in front of the state capitol saying, let's go, let's open up. It was reflected by the fact that the governor there put a cap on not being able to buy gardening and home improvement things, something we haven't done in this state, by the way. You can still do that. It gives you an idea of how antsy people are in terms of the stay-at-home order. One of the signs I thought was a little amusing. I don't mean to make light, but Michigan recently legalized marijuana, and they've outlawed gardening equipment. So the sign said, we can smoke grass, but we can't cut the grass. It's the opposite here in this state, by the way. I noticed that we've had some petitions, for example, from salon operators here on this state saying, May 1, let's go, open up, it's time to open up. And that nobody wants to get opened more than we do. And we're going to spend a lot of time today and then, importantly, tomorrow when we announce the advisory board in terms of steps we are taking to get our state opened up. I know how important opening up is to our small businesses. I know the collapse in revenue. I know the fact that we've got, in part, a lot of supports in place from the Paycheck Protection and our own loan program, but that's not good enough. People are ready to open up. I was on the phone today with the Black and Puerto Rican Caucus, and I was just reminded them that it's easy for me to stay at home. You've given me a really nice home. I can spend a week and not see Annie in the governor's residence. But there are a lot of folks who are multi-generational, living in really contained spaces in small apartments. They don't have a backyard, and stay at home is really tough. And I've got to ask people to tough it out a little bit longer. And I'm trying my best to make it easier for you. You know, a lot of my fellow states are, shutting down parks and shutting down beaches, and I don't think that helps. All that does is squeeze people into more crowded outdoor spaces elsewhere. People still need to be able to take a walk at a safe distance. And Katie Dykes, our commissioner, it's her birthday today, by the way. Katie Dykes has, been tough about limiting the number of cars at beaches and at parks. And I hope that's good enough. I'm on the phone in an hour with all of our mayors and first selectmen, and I'm going to encourage them to go maybe even the opposite direction. Instead of closing down parks, maybe close down some of the roads to automobile traffic so people have more room, not just on sidewalks, but can walk and enjoy themselves outside as the weather gets nicer in a boulevard. That said, working closely with others and looking at best practices around the country, I think it's time for us to also be really strict about the need to wear masks. Even masks you make yourself, just the bandanas or the scarf or the surgical mask, not the N95 masks. They are reserved for our frontline healthcare workers. And, I wear this sort of, it's not a fashion statement, but if you're walking around and you need a little bit of space, you're going up to a group of people there, just put on your mask. If you're walking around in the park and there's a crowd, put on a mask. If they're crowded together, tell them they should keep their social distance, but you be careful as well. We're going to be very clear with our employers that if you're in a public space there, your grocery store and the such, retail, you've got to make sure that your employees are wearing masks. And anybody coming into that particular facility, starting with grocery stores, have to wear a mask. I think this is the way that we're going to get this virus behind us sooner and make sure that we can get everybody back to work as soon as we possibly can. So social distancing is key to that. We're getting the masks as fast as we can at the state level, but right now it's an employer's job and employees to make sure you're wearing that in any place where you have public interface with people. As I mentioned before, we're going to be ramping up the testing. You saw we had a lot of tests today, but that's conditioned upon the swabs. But remember, social distancing and testing and the therapies we're working on that keep people out of the hospital, or at least out of the ICU, cut the amount of time they're there, are all a bridge to getting the vaccine. And that's how we eventually get behind this. That vaccine could be 6, 12 months away. So we've got to be extraordinarily careful in terms of everything you do between now and then to make sure we get this pandemic under control and to make sure we have a bridge to a vaccine that makes sure then we can get back to our life in the new normal as best we can. And I'll talk a little bit about the federal next supplemental that's coming out, but just remember, they've done $2.3, $2.4 trillion. And Governor Baker from Massachusetts reminded us today that almost none of that is going to public health. Almost none of that is going to development of the new therapies we need or how we reconstitute existing therapies to apply to COVID. Almost none of that's going to vaccinations. We got amazing private companies, so many of them right here in the state of Connecticut, that are working on these therapies, working on these vaccinations. But this should be our Apollo project. This should be a real focus of the federal government. This is how we get back to work and get our economy going in a real way, if we put our money where our mouth is when it comes there. The PPP, the Paycheck Protection, you know, some good news. That money is going out. They've already approved about $3 billion in loans for the state of Connecticut. That's to about 12,000 applications have been agreed to right now in the state. There's still money there. You can still go to the DECD or small business websites, or 211 will get you the information you need so you can apply. The $1,200 checks are going out the door as we speak. They should be landing, or direct deposit. That's $1,200 per person for everybody that files a tax return. And as we've said before, if you didn't file a tax return, you're still eligible, and go to 211 and we can get you the information you need on how to do that. I will tell you that the governors were really focused on this next supplemental coming out of Washington. It's been delayed right now. I think the Republicans are more focused on the PPP, the Paycheck Protection, more money for small business, get that going. It looks like the Democrats are focused on that, but also think we need another supplemental to support the states and the municipalities. You know, I think they're both right. But we desperately do need more flexibility in terms of what we provide for the states and for the municipalities. Right now, the federal government reimburses us for COVID-related expenses, but not for a loss of revenue. And as I've said before, that we're in pretty good shape compared to our peers when it comes to making up for the loss of sales tax revenue and some income tax revenue. Other states are in real duress right now. But we're all going to need some backup here so we can round the bend on July 1st, knowing that our budgets are in pretty good shape. You know, I think with that, I mentioned to you that Andy Mays, our amazing insurance commissioner, is on. And I'm going to steal some of his thunder because that's my prerogative. Sorry, Andy. But I'll give you all credit where credit is due, because this is the guy that has really taken the lead. He worked with our insurance providers, remember, going back a few weeks ago, and we got the 2-month grace period. The insurance capital of America, Hartford, Connecticut, helped take the lead in making sure you got a 2-month grace period there for property and casualty as well as for health insurance. And that's a bridge to other loans that make sure your health insurance is continuous. He mentioned today, I was so impressed that for our first-line responders as well, you know, a lot of them have health insurance that is not as full as it should be, with high deductibles and high co-pays. And all COVID-related expenses are covered, just like they are for Medicaid and Medicare and the such. Those COVID-related expenses for testing as well as for treatments. You know, thank you, Andy, and thank you to the insurance companies for taking the lead there as well. And when it comes to life insurance, he gave us some good news today, which is Connecticut and Massachusetts working together with Mass Mutual. There's $25,000 in life insurance provided for each and every one of our frontline healthcare responders, anything related to COVID. And that's going to be free for the next 3 years. So, Andy, I'm sorry to steal your thunder, but I really want to thank you for what you've been able to do there. And also on the line is Kurt Westby, who's going to have some continuing good news as we get those checks out. Over $100 million, I think, right now, and unemployment is going out the door, and a fast catch-up. I think with that, let me just take a break and see what questions. Andy, why don't you just say a little bit more about what we've done on the insurance, thanks to your leadership.
Well, thank you, Governor, and thank you for your leadership here. It wouldn't have been possible without you. What we've done, we've made a number of changes, as you mentioned, to make it easier for people who are facing concerns because of COVID-19. But if I can just take some time to put in a commercial here for our Access Health program. That is our health exchange, the Obamacare or Affordable Care Act, whatever you want to call it. But that is the exchange where people can go to get insurance. And what we've done, and again, this was done with the cooperation of the health insurance companies, is we created a special enrollment period. We've got 2 more days left in that. So it goes till April 17th. If, for instance, you're a member of the gig economy, you had chosen back during the regular enrollment period to not get health insurance, I would strongly suggest you go to the Access Health site. Most people who get COVID-19 will be fine, but if you're not, the cost can be tremendous. So I would think this would be a great opportunity to go get health insurance on the Access Health site. Again, it runs, the special enrollment period runs until April 17th. And as the governor mentioned earlier, part of the good news that we've had, and this came out of our discussions with our health insurers, with the health insurance carriers in Connecticut, they have agreed they will cover from the first dollar everything to do with COVID-19 treatment. So that means testing, there will be no deductible, there will be no copay. If, unfortunately, you need to get treatment, there will be no deductible, there will be no copay. And as the governor said, and I have to give the governor credit, because the governor had raised this concern last week, I think it was, we do have people who went out and they wanted health insurance, they got the best insurance they could afford, but that might have been a high deductible plan. And we did not want them to have to be concerned about their finances if something happened. So all kudos to the health insurance industry. They've stepped up here. We've also seen, of course, the life and auto insurance industry, well, the property casualty insurance industry. They've done a number of things, including, along with the health insurers, we've got that 60-day grace period. I'm sure you've seen in the news that a number of the auto insurers, and there's more being announced every day, it's simply a matter of getting the systems up, are going and they're providing rebates. Actually, I shouldn't call it rebates, but they're giving money back to consumers over these 2 months because of the reduction in the amount of driving. So if you're out on the road, you know that not that many people are driving. It's certainly lower than normal. So the risk that the insurance companies are bearing will be less. Now they're giving you back some of that money. If you call your insurance company and if you have a concern, always feel free to reach out to the insurance department. Probably the easiest way to do it these days is to reach out to insurance@ct.gov. And another example of how the insurance companies have stepped up here, I do have to mention, as the governor said this morning, I was very pleased recently when I got a call from the people at MassMutual, the leadership at MassMutual. They have a foundation that's headquartered in Enfield, Connecticut, and they've got a program that we've worked with them on called LifeBridge that offers life insurance for people of certain income levels. So if anything happens to a parent, then the child would be able to get an education. And they said, we're thinking, what do you think would help if we did this in this current environment? Would it help or the people who are on the front lines, the people who are exposed to COVID-19, if we were to offer them some life insurance? And I said, you get me a proposal and we will turn it around, give it the approval as fast as we can. And my team, I have to give the full credit to my team, Paul Lombardo, and the people at the Connecticut Insurance Department got that done so incredibly fast. Actually, just before I got here, I got a call from the general counsel at MassMutual saying that that was a wonderful job. And I think it's just wonderful. They're offering up to $25,000 in free life insurance for 3 years. There is an income test. You have to make less than $250,000 or $260,000 a year, which means if I were on the front lines, I'd be able to make it. But it would be for anyone on the front lines, as long as you're working for a licensed hospital, licensed EMS, or for emergency, one of the urgent care centers. If you're between 18 and 50, you get the full $25,000. Between 51 and 60, you get $10,000, and it doesn't matter. There is absolutely no cost to you, and it'll last for 3 years, absolutely free. If you go to our insurance department website at ct.gov/CID, you'll see the information. I'm sure Mass Mutual will also have that information on their website. And it's easy. It's going to be done online. What you do is you're going to scan in your badge or whatever that shows that you worked someplace. You just answer a few questions. And it's not just, this is important too, it's not just for the doctors and nurses. It's for the other people in the hospital that may be exposed. We're talking the security people that will be the first people to meet people coming into the hospital. We're talking the custodial staff that may have to clean up and are exposed to the COVID-19 virus. This is there for you. And there are, as the governor mentioned, there are a number of other items that we're doing and that we're still working on. But my one request for you, we're all in this together, and at the insurance department, it's important for us to know if you have any concerns and to be able to help you. So if you have any concerns, please reach out to us at insurance@ct.gov. Thank you.
Thank you, Andy. Any questions, Max?
We'll go first to the Hartford Courant.
Hi, sorry for the delay. This is Rebecca Lurie. Can you tell us more, or maybe clarify your recommendations on wearing masks? New Haven Mayor Justin Elicker just announced that people have to wear them in stores there. New York is requiring masks when you're out in public. Are you making a recommendation or a mandate here?
I am strongly saying this is what you got to do, and it'll probably be reflected in an executive order within 48 hours. And that is, look, if you can keep your social distance, you don't have to wear a mask. If Paul gets a little closer to me, we're going to both be wearing a mask. If you're walking down the block and you're by yourself, that's fine. If you get to a crowded group, wear a mask. If you go into a store, you're going to be interfacing with somebody at the store, wear a mask. If you work at that store, you work at the grocery store, wear a mask. And if your employer doesn't get you the mask, get yourself a scarf or something comparable. I think this is the way that we can get this virus, stop it dead in its tracks, and help this state get moving again.
Thank you. I just have one other question. Golf Digest is reporting that the Travelers Championship will be played on schedule in late June, though without any fans watching in person. Do you think it's too soon for the PGA Tour to be making that kind of call?
I don't. I mean, we are going to be getting back to normal. It'll be a new normal. Let's face it, playing the Travelers not in front of a crowd is a new normal. It's going to be for just this cycle. And I kind of like that report, if it turns out to be true, that we're going to have a chance, at least on TV, to enjoy a sport which showcases the best of Connecticut in a safe way. So I don't think that's too soon.
Move on next to the Waterbury Republican American.
Thank you, Max. I have a question for the Labor Commissioner and I guess his deputy. Can you give us an update on where things stand in terms of your backlog? How long will people be waiting? I believe I saw on the update on your department's website dated yesterday that it's 4 to 6 weeks.
Kurt, did you hear that?
Yes, I heard it.
Commissioner Westby, Bidwell, thank you.
Yeah, okay, thank you. Yes, the backlog recently has been up to 6 weeks, and we are taking active measures to reduce that backlog quickly. As you may know, we've increased our claims takers by a factor of about 4 to 5. We've quadrupled and quintupled our claims takers. We're now putting out well over 30,000 claims per week. The norm in the old days, only 2 months ago, was less than 3,000. So we're still increasing the number of claims takers. So we're evening that out, but we do have a rather big backlog. So we've implemented a technical fix to our computer program, which will enable us to bypass the manual processing of a lot of those claims. We did testing over the weekend of a group of 500. That was successful. We ran another group in our batch system last night of 5,000, and that was also successful. So tonight we're going to be running, as I understand it, about 60,000 of those unprocessed claims. So I think that's going to put a very big dent into the group of claims that we haven't addressed yet. So we're optimistic to bring down that more like 5 to 6 week wait down to 1 week as soon as we can.
And any idea when that might happen?
Well, that depends on the success of tonight's batch system. We are optimistic that we're going to see major progress by next week, and by the end of the week, we should see. We expect and hope to be down to 1 week.
Okay, and just real quick for the governor, I'm not quite sure from your last answer to Rebecca's question what exactly your executive order is going to be doing. Are you going to be issuing guidelines for when and where people should wear masks, and then also mandates for when and where people have to wear masks in public, such as going into a grocery store?
We're going to issue those guidelines to be clear as a day about what you ought to do, because talking to CDC, talking to Dr. Fauci, talking to our fellow governors, the best way that we can slow this spread of the virus, and you saw from our numbers, it's continuing to grow. Sometimes we think we've rounded the bend in a permanent way, but it's uneven, and that's why it's so important that we do everything we can to slow the spread. And I'm afraid that masks are a big part of that. So we're going to be very clear in our executive order about what that involves.
Yeah, okay. But I just want to be clear. It's going to be some places it'll be up to the member of the public to wear a mask, and other places people will have to wear a mask.
Look, when you're walking down the street, like I said, use your judgment. And if you get into a crowd, put on the mask. If you're in a store, wear a mask. That's the rule.
We will move on next to Boceto Media.
Hi, Governor. Can you please elaborate about your plans to provide equipment to nursing providers and home healthcare workers? This morning, the unions had a meeting and they are requesting equipment that they haven't received since the pandemic started. And they are also requesting to have COVID-19 testings paid by the state. Thanks.
The question was about healthcare workers, I guess in hospitals, maybe nursing homes, and protective gear and testing and making that available. And there's no higher priority for us in terms of testing and gear. Healthcare workers are the #1 priority. I've got to make sure you're safe, and I've got to make sure that the people you're treating are safe as well. We've got more of the protective gear coming in. It's not coming in nearly as fast as we want it. Josh can tell you we have a small stockpile. Every day we're on the phone with hospitals. Every day we're on the phone with the nursing homes. And we can make sure on an emergency basis we get that gear as needed. When it comes to the testing, right now we're doing testing, at the nursing homes. But I did hear from Renee Coleman Mitchell of Public Health today that we're working on a mobile testing facility. And that will be invaluable when we can get that up, because that will mean at nursing homes, not only the workers, but also the people at the nursing homes themselves will be able to test, will be able to take the swab, get the test, and have real-time information on the nature of the infection right there. So I think we're making very good progress there, but there's still a way to go.
We'll move on next to the Connecticut Mirror.
Yes, Commissioner Mays, there's the definition of first responder in the COVID-19 pandemic, I think, has become very broad. People, looked at grocery store cashiers as well as law enforcement, firefighters, and so forth. Can you give us a better idea of who will be covered as first responders by this life insurance?
Thank you. According to the terms of the life insurance policy that we've approved, it would be employees of licensed hospitals, urgent care centers, or emergency medical services. Those would be the ones that would be covered under this, that would be eligible for free life insurance.
Thank you, Commissioner. And Governor, you mentioned the burden on state and local governments. If Congress does not come forward with funding to make up those shortfalls, what are the contingencies that you are looking at as far as cutbacks? Are you looking at layoffs? Are you looking at freezing raises that are otherwise due in July?
Well, right now, thankfully, we have a significant rainy day fund. And that rainy day fund will probably have to draw down maybe $500 million in this year, this fiscal year. You know, next year, we'll see where we stand in terms of the COVID. We'll see where we stand in terms of revenues coming in, see how fast we can get this economy growing again, and see what our needs might be there. But yep, we'll have to look at all things will be on the table when it comes to how we bring our budget into balance. But thank God, Connecticut, unlike many of our peers, we do have a cushion. We do have a rainy day fund, and this is what it's there for.
Thank you.
Move on to Hearst, Connecticut Media.
Hi, Governor. Could you get a little bit farther into the 170 people who, the fatalities that you're catching up with? Are these people who died in their homes? Are they people whose the medical examiners just caught up with their paperwork?
Josh, why don't you take that?
It's really the latter. It's a large batch of deaths that we received, the DPH team received from the Office of the Chief Medical Examiner that had been in pending status. So as they clear their backlogs and as they reconcile with the DPH data that's reported, it's essentially catch up over the last 2 weeks.
Are they mostly hospital deaths? Are they nursing homes? Or has anybody? I've been trying to get some kind of parsing for a few days on this issue.
Yeah, for the catch-ups that we're adding in today, I don't have that parsed, but what I will tell you is tomorrow, as we've been promising, we're going to have a lot of detailed reporting on nursing home deaths and infections to come. So that's a very labor-intensive process for the team to reconcile all that data between what we get manually reported from the nursing homes and that which is reported into our public health department on a more automated basis in the electronic records. So what we're doing is every Thursday now, we're going to plan to provide a complete and robust reporting package, including some of those metrics which don't change very often. We talked a little bit yesterday about the ethnic breakdown, the gender breakdown on infections and deaths. Because as we've gotten deeper into this pandemic, the manual nature of generating those reports becomes greater and greater. We're going to, on Thursdays, provide that more robust package, and so you'll see a lot of additional cuts of the data like that tomorrow.
Does that include hospital release data also, Josh?
Yeah, we've reported that a couple days recently. We'll add that from time to time. We're getting that from the hospitals directly. That's easier for us to produce, so we can share that for sure.
Thanks. And Governor, it doesn't seem to be like a uniform mask acquisition approach in the state. Supermarket unions they would like to be classified as first responders to just get easier access to masks. They've been negotiating with your office. I don't know how do you feel about them being first responders? Is there going to be ways for people to acquire masks beyond somebody on the block making them on the sewing machine?
No, I can tell you that our hospitals have gone out very aggressively. They're getting masks on their own. We, as you know, are combing the globe and getting more and more masks all the time. As you know, we got the new Battelle sanitizers. That'll create capacity for another 90,000 masks every day. That's still probably 5 or 6 days away. In terms of our employers, they're out there trying to get masks any way they can, and if they can't get masks, then I think it's time for their employees at least to put on a scarf or some other way that they can provide a protection for themselves and others.
If I could just add,
do you think supermarket? Oh, sorry, go ahead.
If I could just add, it's important for people too to remember the distinction between an N95 respirator, a surgical mask, and a cloth face covering. When the governor's talking about, general people out on the street going for walks and so forth, we're talking about cloth face coverings that people can easily make for themselves. The CDC website has a number of different ways you can make it, from a bandana, from a t-shirt, etc. And so those are easy for all of us to put together on our own. When we're talking about surgical masks, and in particular N95 respirators, these PPE really need to be reserved, particularly today, for people working directly with patients or potential patients with COVID or COVID-like symptoms. And so we want to make sure that's clear as well, particularly for people when they're going into supermarkets, they're going into essential businesses. We really need to reserve those masks for our frontline responders.
We'll move on next to News 8.
Governor, you've been overwhelmed with people calling your office. We have a lot of emails at News 8 about when am I getting my check, when is unemployment coming, when am I going to see my $600 from CARE. They say they try calling the governor's office. They also try calling Department of Labor. How many, I know you don't know how many calls, but how many emails, just kind of put it in perspective for people because I don't think they understand 350,000 claims, what that looks like and what a tidal wave that's coming at you.
Well, I think you know that it's probably 20 times anything this state has ever seen. So that gives you an idea of the scope of the crisis that's confronting the country. It's not just the state of Connecticut. It gives you an idea of the scope of what Kurt Westby had to confront. I mean, we had capacity to take on maybe 2 or 3 times our normal load, not 20 times. Look, we've got a 211 phone number. There's thousands of calls that go in there all the time, every day. We answer those as best we can. A lot of those questions are about food insecurity, a lot now about, as you point out, the stimulus checks and the PPP and when am I going to see the relief? I've got some bills that are due. We're answering those in a real-time basis. For small business, DECD is fielding calls on a, round the clock, or at least, during working hours basis we're doing everything we can to get the answers out. Today I was on with the Black and Puerto Rican Caucus. I was on with governors. In about 45 minutes, I'm on with mayors, and often we do superintendents in schools, doing everything we can to make sure that the frontline people have the information that we have so they can better answer questions.
And for Brendan and Milford, I talked to him earlier today. They're hanging on by their fingernails. They're trying to figure out how to get through, but they can't plan because they don't have a date of when the money might come. You say 4 to 6 weeks? That's from the time they file the claim? We've only been into it for a month right now, since the 13th. That's still a good 4 to 6 weeks? What time frame is still good?
Well, I think you just heard from Kurt that we've processed probably half the checks, right, Kurt, so far in terms of unemployment claims? We ought to be caught up in about a week. Go ahead.
Yeah, we processed probably more than half because out of the 350,000, there turns out there's a lot of duplicates. So we're well beyond half. So we expect, we hope relatively quickly, sometime next week, maybe by the end of the week, we will have reduced significantly the wait period. As for the $600 plus up, we call it, the FPUC, we're working, we've coded the changes that we're going to be putting into the system. We're going to be running those tests over the next few days, and we intend to have a solution by the end of next week so we can begin with doling out those benefits. And all the benefits from the $600 plus up will be automatic and will be retroactive to whenever folks filed their original claim.
So you're processing them in the order in which they come in. So in other words, I submitted mine on March 13th. I probably would get it sooner than somebody who submitted it 5 days ago.
I believe that's the case, yes.
We will move on next to CT News Junkie.
Yeah, so my question is for Commissioner Westby also. So we've heard from a lot of people who have filed unemployment claims in the original setup. And so what happens to your original claim if you refile using the new automated process?
Well, if you use the new automated process, then your claim will be accelerated because it does not have to wait for the manual processing element. You're going to get your benefit much quicker, particularly if you opt for the direct deposit option. And I recommend that everyone, when they apply, opts for the direct deposit option because there's very little wait with that. So we highly recommend using the automated process. But like what I was saying a little while ago, we are going to be bypassing for a lot of these claims the manual process anyway. We're going to be putting folks into the automated mode wherein they just have to follow instructions from an email that we will be sending them, but they'll be automatically put in.
And so what kind of signals should they be looking for an email? Is there an email to kind of ensure them that they're in the system and they're going to be processed?
Correct. They will be receiving an email from DOL telling them of their status.
And what about the self-employed? Have you guys come across that situation yet, and have they received any benefits yet under this program?
The self-employed have not. Normally, the self-employed do not receive any benefits under the PUA, the Pandemic Unemployment Assistance component of the CARES Act. They will. We are building out that system. That is a completely new system that we never had. It's going to be based on a DUA system that we have working with our partners with the consortium that we're members of, with Mississippi, with Rhode Island, and with Maine. We are building that system out now, and we intend to have that system built out by the end of the month and being ready to be accepting applications on April 30 and thereafter.
Okay, thanks.
Move on next to NBC Connecticut.
Good afternoon. My first question is for Commissioner Westby. We continue to get calls from frustrated viewers saying that they've been trying to apply for unemployment since this all started nearly a month ago. They haven't received responses to emails they sent a month ago to the Department of Labor. They call more than a dozen times before they get a live person, and then when they finally do, their claim seems to be fixed. They go online, they see there's still issues, specifically a lot of people saying issues with the date. I know you pull people out of retirement and you pull people from other departments to help, but why are so many people in the state continuing to have difficulty getting help?
Well, I think the reason is because we've had a tsunami of claims, and it has challenged our system. Remember, we have a 40-year-old COBOL-based system, which was simply not designed to accept this many claims. We only had 20 people managing our claims unit at the time. As I said, we've really increased those numbers. So every facet of our operation, including those folks, the people who manage our webinar, the people who answer the phones, we've been increasing staff. But this tsunami has just overwhelmed everything we've had, like it has in many, many states. So I can only say be patient. A lot of these claims are duplicate claims, so we're in process of fixing those duplicate claims. And yes, there is a lag. And I know any claim, any person who's out of work is in a crisis. So we're working all day, all night, overtime, weekends, holidays to rectify the situation. Just try to be patient. And I really believe that the automation fixes that we've been putting in recently are going to help that situation a lot.
Okay, and moving back to the masks, Governor, I know you're still working on that executive order, but have you talked at all about how you might enforce the requirement that people have a face covering in some place that's busy, such as a grocery store?
Yeah, right now it's being self-enforced. We've noticed in terms of the restrictions we put on other retail, like grocery stores, in terms of the occupancy, the number of people who can be there, 6 feet apart at the cashier's line. People are overwhelmingly following that lead. And sometimes folks send us a video. Sometimes we look online, we get a heads up. Maybe we'll send somebody out to report on a store that's probably not taking it as seriously as they should. And we've been pretty diligent about getting out to folks like that. I just thought now was a time where we could lend some even more clarity and urgency, just as spring fever is beginning to strike, to remind people how important it is that masks are going to do the best we can with what we've got to slow this virus down.
And lastly, nursing home workers continue to say they don't have enough PPE. They're staging a protest tomorrow. If I know you're releasing your own numbers tomorrow, but if their numbers are right, a large portion of those who've died from COVID-19 have come from nursing homes. Where do they fall on the priority list as far as getting that personal protective equipment out?
I'll start, and then maybe Josh can fill in. But what I can tell you is Josh is on the phone every day, or at least our team is, with the nursing homes. We get a gauge of what they need in terms of masks and other protective gear, and get everything out to folks that are in need. Most of those places do have a supply that they're able to manage with. Some of they've run short. We're doing our best to make sure we get that additional gear to make sure each and every one of those folks at the nursing home, starting with the people working there, are protected.
We'll move on next to News 12. We'll move on to Channel 3 Eyewitness News.
Sorry, Max, I had the wrong thing. Can you hear me now?
Go ahead, John.
Okay, great. So Commissioner Westby, I just kind of want to circle back to some of the frustrations folks have had. We're hearing from a lot of people who have gotten their application approved and processed, but then they try to file their weekly claims. It gets rejected for whatever reason, and like NBC said, they try for hours and hours to get anyone on the phone to answer a question. What are those people supposed to do? And is there any thought about, just hiring from outside to staff a phone bank to answer questions like that?
Well, we will be hiring more people, especially to manage the PUA, and we are still actively hiring people to manage the claim processing. But remember, it takes a very experienced person to handle these claims. The claims can be very, very complicated. So you can't just stick someone in there quickly without a significant amount of training. I also think that the technical fix that we applied will wipe out a lot of those concerns. And we're working on dealing with the duplicate claims as well automatically. So I think that could go a long way. And our Deputy Commissioner Daryl Dudzinski, who is on the line here, may have some additional information on that too.
Sure, yes. Thank you, Commissioner. Lots of great questions about the unemployment insurance, and our agency certainly is doing our very best to remedy the situation, the backlog. As the Commissioner said, we have a plan of action we've been working on for a very long time. It's a very old system for our unemployment insurance program. So right now, we're saying people are waiting up to 6 weeks. By the end of next week, the goal for the agency is to have it down to a week, and we'll be able and to maintain that. In order to do that, we created programs in which somebody has to make decisions along the claim application process, and we've automated that. And that is now going into a strong live session tonight, as the Commissioner said, about 60,000. So the key with the communication, since we're not, our doors are not open to the public, and we have very limited telephone opportunity, the key communication with our agency is via email. So when the claim is submitted by the customer, they do get an email saying it's been submitted. The next step would be for us to process it, and we're going to start moving those quicker through the automation, and also by removing some of the duplicates. And by the way, with the duplicates, we want to use the oldest one, the initial one that was submitted, so that no one is harmed and their claim is effective with that claim week ending day and for that retro payment. Once we process it, they're going to get an email from us, and it will specifically tell them what the next steps are. There's two emails that they could receive. One, where we're telling them their claim has been processed, and then what we would do in the situation where they are told via the email to file their own weekly claims going forward into the future, what we would do for them is because of the backlog, we have created automated programs to file those weeks of unemployment for them so that if they are in a payable status, they will receive that money and be made whole, retro from the effective date of the claim all the way up to the prior Saturday. And then going forward in future weeks on a Sunday, they can begin filing their own weekly claims if they remain unemployment. The other email that they would receive is if they are in what we call a temporary shutdown program. And that program is fully automated. And that's really where we want our customers to be. And that program explains to the customer via email that they do not have to file their own weekly claims. We will do that for them up into a period of time where we don't know if they're back to work or not. So at that point, we will take them out of the temporary shutdown program and we will set them up to file their own future claims. And all of that would be communicated via email. And most of our customers, 95% are following the instructions correctly via the email communication. There are certain customers, a certain percentage that we realize are logging in and they're using their wrong social security number, they're using their wrong username, and therefore they're getting errors in accessing the system in which they could file their weekly claims. So, as we prioritize and try to get through this backlog, we will get back to the ones that had made those mistakes and fix the mistakes for them and get them in a payable status. But the key really is for individuals to have their email, know that we're going to catch them up by filing their weeks for them in one instance, and we'll let them know to file in the future. If they jump the gun and they try to go in and file their own too soon, they won't be able to and they get frustrated. If they wait a day or two during the work week, we're running batch systems to do that catch up for them. And again, if they're in the temporary shutdown program, which is the best program for them, it will file their weekly claims up until a certain point in which we can no longer do that, and we'll communicate that change via email, and then they can move forward. So again, we're trying to get through this backlog by the end of next week. We're also trying to make sure that we have the 600 plus up program tested and implemented by the end of next week and get those programs up and running, so that we can also have the PUA for the self-employed, begin taking those applications and continue on with the other federal extensions that we're responsible for administering.
We'll move on next to Channel 3 Eyewitness News.
Hi there. This question is for Commissioner Westby. Like every other media outlet, we've also received many viewer emails about how to file an extension. A viewer told us that her employer asked them to use the return to work date of April 1st. Many people did. Now they are being told that the return to work date expired. They were told to continue filing online, but cannot extend the date anywhere. And they're basically locked out. So how can people extend their return to work date without filling out an entire new application again?
Daryl?
Sure. So in those, we realized that from the very beginning, and that's why we had to create multiple programs to address that. So when somebody had a return to work date, for example, if it was April 1 or April 15, what we've done is we identified those individuals and we removed the return to work date because it was no longer valid. And we sent them an email and we advised them to file their own weekly claims going forward. And if the person did not read their email or didn't receive it, went to spam or junk email, it's going to be unfortunate for them. But the bottom line is we created a program to take care of that, and we run that program every week to identify all the future return to work dates that need to come down and set them up so that they can file their own weekly claims going forward if they remain unemployed. If somebody missed the email and now they're off a week, what they would do is go on to our online assistance center, and there's a specific email that indicates they missed a back week or two, and they can fill out that email and submit it. And what we will do for them is we'll process the prior missed weeks and get them caught up, so to speak, so that they can resume their own weekly filing if they remain unemployed. So there is a safeguard mechanism via the email on our online assistance center.
We'll move on next to Fox 61.
Zinnia Maldonado, Fox 61. Governor, you mentioned 6 to 12 months until a vaccine. Would you consider strict precautions similar to what we're doing right now to last that long? Also, is there any CVS testing center update?
No, I don't expect it to last that long. I think you're going to find a protocol of testing that gets people back to work a lot sooner than that. But testing, masks, these are all bridges to getting the vaccine. It's the vaccine that will eventually keep us safe from the COVID or a resurgence of the COVID. The CVS testing sites, I think I told you that Stanford and New Haven will be the first two priorities, and I think they'll be up and operating in the very near future.
And this past weekend, free priority COVID-19 testing sites for first responders were expanded to include grocery store workers in Massachusetts. Would you consider doing the same expansion here in Connecticut?
Yes, as soon as we got the capacity, absolutely.
We'll move along next to WTIC 1080 News.
Good afternoon. The scene in Lansing, Michigan, people jam-packed to protest, I guess, science this afternoon. What would you do if you're faced with that kind of scene at the Capitol? There's a lot of disease spread potentially in groups like that.
Yeah, we referenced that protest earlier. Look, I understand the frustration of people. They're cooped up. Their businesses are shut down in many cases. But we have an enemy here that's in our midst. It's invisible, but it's attacking us every day. And I know right now with spring, and we've been in stay-home mode for quite some time, there's a real tendency in Lansing, Michigan, and parts of Connecticut to let's take our risk and go out there. And what I'm trying to do every day when I do these events, these briefings, is to remind people that if you can just keep the discipline going a little bit longer, it'll make sure that this virus is behind us a lot sooner and we can get back to our daily lives. That's what I've got to remind people every day. That's what we tell our mayors and our first selectmen and our first responders in general. Just maintain that discipline a little bit longer. We'll all be better off for it.
But how would you respond if a throng like that shows up at the state capitol in Hartford?
Oh, if there was a big demonstration like that at the state capitol in Hartford?
Yeah.
Hope they honk their horns for an hour and then go home and stay home.
We'll move on next to the Associated Press.
Good afternoon, Governor.
Good afternoon.
You mentioned earlier that you were hoping to build up a stockpile of PPE. That made us wonder, has Connecticut had a stockpile in the past? And if yes, generally, how old was this stockpile? How old were our supplies and what was in it?
I'll start with that, and then Josh can take over. Right now, we've been in what they call just-in-time inventory for a long time now, last 6-8 weeks. And everything we got, we categorize, we get it out to regional distribution, we get them to the people in need. There's been very little margin for error, and that's a problem. I tell you, our hospitals have done a pretty good job. They had stockpiled, and they had a fair amount of capacity heading into this crisis. But obviously, the use of all the PPE gear, starting with the masks, is accelerated almost as much as the unemployment claims over at the Department of Labor has. So they drew down those stockpiles pretty quickly. The good news is we've stayed ahead of it. We've stayed ahead of it in part thanks to social distancing. So in the vast majority of cases, we've had the gear that people need. We've had the masks that people needed. We've certainly had the vents and ICU rooms that people needed. But we're not that far ahead of the sheriff, so to speak. And that's why we are searching the globe, and I think we're going to be in a much better position in terms of PPE in 10 days, at least with more breathing room, more of a stockpile, more ammo.
Well,
but did we, maybe Josh can answer this, did we have a stockpile before the coronavirus? And if so, what was in it and how old was it? Because the president has said states already had their own stockpiles.
I think like a lot of states, we had some N95 masks from the H1N1 outbreak in 2009, I think it was. So they were obviously aged. They were no longer rated for use as a N95, but we use them as surgical masks. They're perfectly good as surgical masks approved by the FDA. But I don't think any state really had a large stockpile prepared for this type of event. When we talk about building up a stockpile now, it's less about thinking even years out into advance. It's more about the challenges we face in the coming months and the governor's desire to get much more PPE out, so we're not kind of going day by day, week by week, as we are now with a lot of our nursing homes and first responders, but we get a buffer stock there, and then we can also start to open up the concentric circles of people that we'd like to be able to provide higher grade equipment for, as the governor talked about earlier, some of the additional essential businesses, for example, manufacturing as well. So that's really what we're trying to stock up for is the coming months right now.
We'll move
And
on.
Governor,
Oh, sorry.
can I just ask one more question? Governor, regarding the regional group that wants to work together on reopening the economy, are all the states expected to follow the same guidelines for testing, contact tracing, and reopening parts of their societies? Or is this mostly like a group that's going to be consulting with one another?
It's best practices, Sue. Cuomo in New York, they're really at the vanguard in terms of antibody testing. They're doing a lot. They've developed out of their own public lab, which is 10 times the size of ours. When it comes to some of the rules, for example, we close down bars and restaurants at the same time. You can sort of understand the reason why. So you don't have people going back and forth across the border. So for some of those social distancing things, we probably reopen simultaneously. But basically, Connecticut's in a very different situation than some of our neighbors, and Fairfield County's in a very different situation than Tolland County. So we're going to be able to customize our response as best we can, doing it the Connecticut way.
We'll move on next to Identidad Latina.
Hello, Governor. Since the undocumented community will not receive much of the benefits from the CARE Act, have you been talking to community leaders on how the undocumented community can receive support?
Who's not receiving the support they need?
Undocumented community.
The undocumented community. Look, I put out a ruling very early on, and the hospitals are not charging anybody for COVID-related care, testing and treatment. And that includes the undocumented community. That includes the people whose insurance was partial. You heard that from the commissioner a little bit earlier. It's really important that everybody, no matter what their status is, knows that it's important that if you're not feeling right, if there's a problem, get tested and get the care you need. We do not need any carriers out there in the greater community because they fear that they can't get the health care they need and deserve.
And Commissioner Westby, if there are people whose weeks of benefits are running out due to having been unemployed previously and then getting a job before COVID and now being back on unemployment, when will the 13 additional weeks of benefits kick in?
The 13 weeks of benefits should kick in after their regular 26 weeks of benefits are expended. So basically at that point.
For example, if there's been a lot of, a backlog right now in the system. So what if their benefits and a lot of benefits from the CARE Act haven't been implemented yet? Will they have to wait until it's implemented for them to start getting those benefits?
Well, I think that with the efforts we're making right now, I highly doubt that because there's a lag in terms of the number of people who are having benefits right now. So I don't think there will be many at all folks who will have a break in benefits, but we'd have to check on that.
We'll move on next to Connecticut Public Radio.
Hi, my question is for Commissioner Westby. Commissioner, I guess, could you maybe describe just the rate of people filing for unemployment benefits right now, and if that rate is slowing at the moment or if it's growing?
I haven't looked at the numbers recently, but I have noticed over at least maybe the last week that it seems that the rate of increase of the number filing, and that includes duplicates, and that includes people who are self-employed. That rate has been certainly not increasing, and our rate of handling the claims has been increasing. So I think that that's leveled off, and that's another reason why the effort we're doing with the automation, we think, is going to put a serious dent in the number of unopened claims. So we're optimistic about that.
And a really quick follow-up question for the governor. Governor, just how would you characterize the level of federal support for dealing with this massive spike in unemployment claims?
Everybody had some catching up to do, including the federal government. But I think when it comes to unemployment claims, you know, they stepped up. What I'd like to see them do now is make sure they don't totally drain our unemployment fund. You know, Kurt, we built that up to the tune of, I don't know, a couple $100 million in the last year and a half. We were ready for a normal recession. This is no normal recession, so I'm really going to need the feds to make sure they don't leave 50 states with bankrupted unemployment funds. I just want to say, because we've got a fair number of mayors and first selectmen waiting for us, essential workers got a new meaning for me. And I've noticed that being an essential worker, there's no correlation between being essential and how much you're earning. You know, we spent a lot of time, we've talked about nurses, we spent a lot of time talking about the food service workers and others that are deemed essential. I like to just say a shout out to the janitors. Folks that I got to confess, I sometimes took for granted that my office was clean the next day. And I don't take that for granted anymore. I know these are folks that are really more important than ever in terms of keeping our surfaces clean and make sure that they are playing their role in defeating this COVID crisis as well. So I'd like to give a shout out to the essential workers and a big shout out to the janitors in this case. Thanks, each and every one of you.